Oh, hang on. Yep, now I can. All good? Yes, sorry.
You can see?
Okay.
Yep.
Yep, cool. Yep, sorry. Oh, wait a minute.
Okay.
Ooh, I'm just finding it difficult to get my um hang on. I'll try. And if I miss a word, then you'll have to fill it in because for some reason something's blocking part of my screen. But that's okay.
Oh, okay.
So I'll be
Okay.
Fatima. Yeah, I'll be Fatima. You be
Yep.
Dr. Sol. Yeah,
Okay.
cool.
I would like to go through your medical history and also get more information on your family history. I see that you are from Afghanistan. Did you know that type 2 diabetes is common in that part of the world? Is there diabetes in your family?
Yes, my father and my grandfather both had diabetes.
It is likely that you also have diabetes. Your symptoms are common ones for this disease.
Oh dear. I thought I was just tired from all the work I have at the moment. I have not been paying attention to my health.
I will give you a referral for blood tests. If they confirm the diagnosis, we will discuss a medical plan to help you manage the condition.
I know from my
Uh,
father that I need to watch my diet. I'll cut back on sweet food. I'll start exercising again. Will I need to take insulin shots?
we will know when the lab results come back, but you will probably have to monitor your blood glucose, that is, blood sugar, with finger prick tests through the day. I'll also write you a referral to consult with a dermatologist for advice on skin conditions that are common in diabetics. Okay, so um, yeah, why don't we have two people doing the reading? Will we do the whole three slides?
Yeah.
Nikki,
Yep.
two
Do you
people
want
with the
two
whole
people?
slides? Yeah.
Yep.
Yep.
Sarah
So we can
Gahari.
come back. Yeah.
Yes, ma'am.
Sarah. Yep. You can be Dr. Solvi. And Latifa. Latifa. Are you here, Latifa? Okay. We will move to Zarifa.
Yes, ma'am.
Zarifa.
No, she
Yes,
just
I'm
came.
here.
She just
Oh, sorry, Latifa. Okay. Is that you, Latifa? Yep. Okay. So you can be Fatima.
Yes.
Okay, cool.
go ahead. Go.
Okay, in the name of Allah, I would like to go through your medical history and also get more information on your family history. I see that you are from Afghanistan. Did you know that type 2 diabetes is coming in that part of the world? Is there diabetes in your family?
Yes, my father and my grandfather both had diabetes.
So I'm just going to interrupt here and just get you both to say diabetes. So we pronounce that
Diabetes.
diabetes. Yeah. Diabetes. Yep. Okay. Will we keep going?
Yep. So
Yeah.
that was Sarah and Latifa, right?
Yep.
Are you still going to keep going, Sarah and Latifa? Keep
Yeah.
going?
Sarah, yeah, let's go. Keep going, Sarah and
Yeah, keep
Latifa.
going.
Okay. It is likely that you also have diabetes. Your symptoms are coming once for this disease.
Oh dear, I thought I was just tired from all the work I have at the moment. I have not been paying attention to my health.
I will give you a refill for blood test. If they confirm the diagnosis, we will discuss a medical plan to help you manage the condition.
I know from my father that I need to watch my diet. I'll cut back on sweet food. I'll start exercising again. Well, I need to take ins- insulin shoots.
Yep.
Yep.
Insulin
We will
shoots.
We will know when the lab results come back, but you will probably have to measure your blood glucose, that is sugar with finger prick test throughout the day. I will also write you a refill to consult with a dermatologist for advice on skin conditions that are common in diabetes.
Okay, that word is
Diet.
dermatologist. Dermatologist. Can you say that?
Dermatologist.
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 Good. Yep. Good. So thank you for reading that. There were lots of hard words in that one. So good work for trying them. Yeah. So words from the dialogue. So the dermatologist is the name of the specialist who checks skin. So the doctor for skin conditions. So we've had lots of words to do with infection. So if something is infected, like this ugly toe here, so we use the term for infected when it's already been, has an infection going. Then we say infect, and that might be referring to you might infect somebody. If you sneeze and the germs go from you to someone else, then you might infect them. Or for example, a mosquito might carry the disease and infect you from one person to another. Infectious is the related word that refers to a disease that can move from one person to another. So it has the capacity, if it has the capacity to move from one person to another person, then we call it infectious. So condition and disease are similar terms. For a condition, that could be a health problem, like a disease, or it could be a normal physical state. It's kind of referring to, I don't know how to, Nikki, can you help me out here? Sorry,
Yeah,
I
I
should
think
have.
well, condition is just the state, the way that your body is feeling, whether it is
Yeah,
feeling in a good condition, in a bad condition, if you're feeling tired condition, and that condition could be because of a disease that is the health problem. It could be, but it could just be that you worked very hard, so you feel tired, so you might be in a tired condition. But
yeah,
or you could be
yeah.
that you are getting a cold or a flu and you might be tired. And that way it would be because of a disease. So these are just
Thank you.
words. So disease is very
Yes,
clearly something like a proper,
yes.
it
So
is something
yeah,
very wrong with you. Yeah.
so it could be normal, like people refer to you when you're pregnant, they refer to your condition. They say in your condition you should not do this or you should do this. You know, you should not eat raw fish or something like that in that condition. So it's not a disease, it's just that you're a bit different from normal. And just like for overweight and obese, right? You still have that condition of being like that, but it might not have any health consequences. You could be perfectly healthy. But then the other thing is when you go to hospital, especially in the emergency, they'll often refer to you when you're in hospital, whether you're in good condition, a stable condition, meaning that it's not that it's that you're not going to immediately get worse. You're actually stable and you've got the potential to get better, or you might be in a serious or a critical condition. I actually meant to change that to critical. So then the other thing we might call something is a disease. But to be a disease, we actually have to have a known cause, like we know what the actual thing that's happening inside your body is. It has symptoms and it can be diagnosed. So diseases can be infections like influenza, malaria, polio, or they could be something that's gone wrong in your body, like diabetes or cancer. Go to the next slide. So more words from the to monitor. So there was a bit of a problem pronouncing monitor. So to monitor. The monitor is when we just track something. So we just have a look at it from time to time. We just so we can monitor your heart, your blood pressure. Might be one thing that you might monitor. You can take a blood sample, like for diabetics. You could do a measure your heart electrical activity. So these are examples of how you monitor something in a health situation. So glucose and sugar, many of you I know will already know these terms. Sugar is just the general term for basically sweet stuff, right? And it's usually a complex mix of compounds. Whereas glucose is the very, very simple, almost the most simple example of a sugar. And when you if you take sugar in your tea, then your digestive system breaks it down until it's glucose, and glucose then gets absorbed into your blood. It'd actually be glucose and fructose, but anyway. Then we have diabetes, and again, a lot of you will already know this. Can somebody turn off, mute their thing? Yeah, okay. So type 1 diabetes is the one that you get in childhood. So both type 1 and type 2 diabetes have got a genetic component, meaning that you can inherit them from your parents. But the type 1, it always shows up. If you've got the gene for type 1 diabetes, then you're going to get it, and you're going to get it when you're a child. Whereas type 2 diabetes is you have sorry guys, we need somebody to check that they've muted themselves. I'm not quite sure who it is that's microphone is on. Let's have a look. I can't see who it is. Okay. So type 2 diabetes. Oh, thank you. Thank you.
I muted.
Thank you. Thanks for it. Type 2 diabetes, like I said, is also inherited, but it's the inclination to get it. It's the potential to get it. So you might not get type 2 diabetes even if your parents both have it, if you live a very healthy lifestyle. Okay, and then the classic drug for correcting diabetes is insulin. So insulin, when it's injected, helps you take the glucose out of your bloodstream and use it in your cells. All right. So let's have a go at this exercise. So we'll practice. And this is a little bit different from the other exercises that we've done. So I want you to have a look at these words, and I'll read them out again. Infectious, malaria, glucose, conditions, disease, sugar, monitored. So have a quick look at that, and then you're going to put those words where the gaps are. So just have a quick look and see if you can find the words that fill into those gaps. And in the meantime, Nikki will we get a separate person for each line, Nikki, or one person?
We could get a separate person because they're quite a lot
Yep.
and they're quite heavy.
Yeah.
So yeah, maybe
Yeah.
we could do a separate one. That way because there are a lot of
Okay.
people in class. Yeah.
Yeah. Let's do that. So who's next?
Zarifa, are you here today?
Yes, Mom, I'm here.
Okay, my
Can
dear,
you
can you do
read
the first?
can you read the
Yeah, of
first
course.
one?
Yeah, sure. Quit is an infectious condition.
That's interesting. First of all, we pronounce
Yeah,
this COVID. We say COVID. Can you say COVID?
COVID.
Yep.
COVID.
So COVID, yep, is an infectious. That's very good. But remember we talked about the two different words that you can use? We say condition or disease. So do you think it's a disease or a condition?
Yeah.
Which,
Second subject.
no, so this one, COVID is an infectious. What do you reckon? What's the next word?
Disease.
Yes,
Yeah.
disease. Yep. COVID is an infectious disease. Okay, next one. Who's going to do the
Okay.
next one?
Mahen, are you here today? Mahen? Okay. We'll go to Masa. Masa, are you here?
Yes, I'm here.
All right, my dear, can you do the second
Can
one,
you do this
please?
one?
Okay. Malaria is a disease that is carried by mosquitoes.
Good work. Yeah, because we didn't
Mosquito.
actually, I didn't tell you that that mosquitoes carried malaria. Can you say this word? It's mosquitoes. Mosquitoes.
Mosquito.
Yeah, mosquitoes.
A funny word.
It is a funny word.
Thank
Okay,
you.
next person. Next person.
Next person is Nadia. Nadia,
Yes, teacher, I'm here.
excellent.
After his operation, Joe's health was monitored in the recovery room.
Great.
Good work.
And you pronounced monitored very well. But I think I'd like to hear you say heart again. Can you say heart?
Okay, heart.
Yeah, good. Thank you. Okay, next person. Good work.
Next person is Elaha Ashrafi. Elaha Ashrafi.
Yes, miss.
Okay.
Pregnancy and obesity are conditions that can lead to diabetes.
Great. Good work. And so this sentence helps show the difference between what conditions and disease is. So I just realized diabetes is a hard word to pronounce
No, it's
for
not that. Sorry, Jade. I think that
it's pronounced
probably
differently.
they have the word in their language.
Oh, yeah,
So
yeah, yeah.
In
That's the
Afghan, you
word.
say diabetes,
Yes,
and
ma'am.
we
In
say diabetes.
Afghanistan, people
Yeah,
say diabetes.
that's right.
Yeah,
Exactly. Because
sorry.
in
Yeah,
my language, in my other language, we say diabetes as well. So I know
yeah.
that because we don't have that I sound. So yeah.
Even all
So
doctors, they say
the
diabetes.
doctors say too. Yeah,
That's why
Yeah.
the
I
people
know.
Okay.
heard these words.
It's just
Yeah.
pronounced differently in your language. So in
Right.
Yes.
English, we say diabetes. Very weird. In
Diabetes.
your
Yeah.
language and most other languages, it's diabetes. But
Yeah.
yes, but good.
Yeah.
Diabetes.
Yeah.
Yeah.
Thank you. Okay, next person.
Okay, Shukriya. Shukriya?
Yes.
Amiri? Yeah.
Mirino, I'm Shukriya Sadaqat.
I'm Shukriya.
Oh, minute.
Shukriya?
Okay. Yes.
Can you do this
Glucose
question?
is, yeah.
Yep.
Glucose is a very simple sugar that the body uses for energy.
Good work. Thank you. And the last one?
Suraya. Suraya?
Yes, mom.
Okay.
In the name of Allah, starch and sugar can't get into the bloodstream. They are converted the glucose first.
Very good. Yes, that's good. Good work. Thank you.
Thank you, teacher.
Okay. So another one, we'll do a matching exercise. So this is back to what we usually do. So can we maybe we'll get one person to do, I guess I'm a bit worried about getting through everything. So if we get one person to do three of them.
Yep, that's cool. Okay, so Mariam Ayobi. Mariam Ayobi?
Yes, ma'am.
Okay, go.
Can you read this one out and then tell us which picture matches it?
Yeah, of course. Many infectious diseases are spread by insects. Number 4.
Great. And this one?
Jack is infectious. I think number 2.
Good. Yep.
Overweight is not always bad for your health. Number 1.
Nope.
I
Don't like
thought that too. I thought that too. Yeah.
No, I agree that it could have been number 1, but I don't like number 1 as much. I think there's a better one.
Yeah, but it could be number 5 as well because there are so many people that
and also because they look healthy as well.
Yeah.
That's why I like that one better.
I get it. I think it's number 5 too.
Yeah. Okay, next person. We'll do these 3.
Sorry. Elaha Rizai. Elaha Rizai. Yep. Go.
In the name of Allah, Maryam has an infection. It is number 3. Picture number 3.
Yep.
A Lactose infection. It is number 6. Obesity. Obesity puts a lot of stress on your bones. It is number 1.
Yes. And I think this one is also, they are more obese, whereas some of these women are probably overweight rather than obese. And also we can see the bones in that one as well. And also this is just to point out that we sometimes use a medical term just in general language. So laughter is infectious. Yep. Thank you.
Thank you.
Go to the next
Thank you so
one.
much.
Yeah. So next person to do these 3.
Okay. Tamana Shahab. Tamana, are you here?
Yes, ma'am, I'm here.
Okay, good.
Can you do these 3? Read them out and pick the picture.
A healthy diet is important for the diabetics.
Yep.
Great gives herself.
So
herself.
Okay. Yep. Insulin.
Yes, ma'am.
Can you say
So that
insulin?
word insulin.
Insulin.
Yep.
Shoes daily.
Yep.
Finger press can be used for blood tests at home.
Good work. Okay. So that's a good attempt at that. Thank you. Do you want to try to put the pictures that go with it, or will we get somebody else to do that?
I can get Fatima Gulami to go next. because we've got a
Yep.
few together,
And
so she could maybe
yeah,
try.
so she can read
Yeah,
them out and match the
yeah.
pictures. Yeah.
Fatima,
But
Gulami,
Yes, Mom, I'm here.
okay. Can you
would
do
you like to
those
read
three?
and match the picture?
Yes. A healthy diet is important for diabetic. It's belong to number 6.
Don't think so. I agree that number 6, it looks like that girl is diabetic, possibly, but this one is more about diet. Do you
Yes,
know what
it's
diet?
number 2.
Yes, good. Number 2.
Number
Yep.
2.
Next one.
Rita gives herself insult shouts daily. Number 6.
Yes. Good work.
Finger
Next one.
picks can be used for blood tests at home. It's belong to number 1.
Good work. Okay, next person. They can do
Type.
these 3.
Okay, the next person is Rahila. Rahila, you here?
Yes, ma'am, I'm here.
Okay, good. You can do the next 3.
Read this out and match it with the picture.
Type 1.
Yep.
Type 1. Diabetes is less common than type 2. Diabetes.
Yep. Type 1 diabetes is less common than type 2 diabetes. So this is a hard to match the picture, but we've got rid of some answers. So which one do you think it might be? Which diagram?
I don't know, Miss.
Okay. We'll get somebody else to have a go.
Yeah, we might have Zakia. Zakia?
Thank you,
Zakia?
Rahila. Thank you.
Are you here, Zakia? Okay, Sarah Pashtunia. Sarah?
Yes, ma'am.
Okay, can you do
read
these
this one?
ones for us? Yep.
Yes. Type A disease is less common than type 2 diabetes. It's number 5.
Number
Yes,
5.
good.
Right.
Yes, because in this pie chart, most of it is taken up with type 2 and only a sliver for type 1. Yep, good work. You can do the next one as well.
Thank you, teacher.
Family history, do you want to read the next one?
Yes, ma'am.
Sarah? Yeah, read the next one.
Family history increased to chance of getting diabetes. It's number 4.
Good work. And the last one?
Blood vision for wound healing and feeling thirsty are students of diets. It's number 3.
Good work. So symptoms, that word is symptoms. Can you say symptoms?
Symptoms.
Good. Good work. Thank you. Okay. Thank you. We'll go on to the next. Do you think you're going to be able to read? Can you read these ones, Nikki?
Yeah, I can. Yes.
Okay. So I'll be Jenny and you can be Fatima. Jenny chats with Fatima. What did your GP say about the lab results?
My blood glucose was very high. That probably explains my symptoms. The other blood tests didn't show any long-term changes yet.
That's good. It's important to get your blood glucose back into the normal range. Too high and too low are both bad for you. Hormones tell our bodies to either soak up more glucose or release more glucose. That brings the levels into balance.
I'll take metformin tablets to start with, and if I change my lifestyle, I should be able to regulate my blood glucose back into the normal range.
Yep. Actually, I didn't know about the metformin tablets. Have you heard of them before, Nikki, for diabetes?
No, Jade, I have not.
No, me either.
Need to hear
I
a
wondered,
pattern.
I
Metformin
thought
for
maybe we could
diabetes.
ask some of the
Maybe
Yeah.
students know.
Yeah.
Yeah.
Do you have metformin tablets for diabetes? You can stick it in the
Does
chat
anyone-
if you know the answer.
Yeah.
Yeah.
I've never heard of it myself, but I don't have diabetes, so I
No,
don't
me
know.
either.
Yeah.
And I don't have a
Okay.
Okay. Talking about hormones, have you noticed the changes in Hugo and Ali? They have both shot up.
Oh, yes, puberty is starting. They are getting moody, and Ali's voice is changing.
Hugo needs to start using deodorant. Puberty is an example where hormones don't keep them balanced. Instead, they surge and make big changes. So when we say shot up here, they both shot up, that's referring to when you have a growth spurt, when you quickly increase in size. So that's what shot up is referring to there.
You know, when children suddenly they get bigger very quickly, that's we say shot up. It's a funny word because shot, of course, has many meanings. So you could look that up.
That's probably an idiom, isn't it?
Yeah, it is.
Yep. Okay, so will we get two people to read this one?
Yeah. Look, I've got Gulsum Pashtunya. Gulsum, are you here?
Yes,
Gulsum?
teacher, I'm here.
Okay. And Tamkin, are you here?
Yes, ma'am.
All right. What
Yes.
about you both can do it? Jenny, you can both be Jenny and Fatima. Okay.
So
You be Jenny, Gulsum.
You be Jenny? Yeah. And Tam, can you be Fatima? Go ahead.
Okay. Okay. What did your GP say about the lab results? My blood glucose was very high. That probably explains my symptoms. The other blood test didn't show any long-term change yet. That's good. It's important to get your blood glucose back into the normal range. Too high and too low are both bad for you. Hormones tell our bodies to either soak up more glucose or release more glucose that brings the levels into balance. I take metformin tablets to start with, and if I change my lifestyle, I should be able to regulate and blood glucose back into the normal range.
That was very
Thank
good.
you. Yes, very good. There's lots of hard words in there.
So
You guys did a
hard.
good
Good
job.
girls.
Yeah.
Okay.
Thank
So
you,
we
dear
might
teacher.
we'll get two different. We might get two different ones now. So I think we'll get Shukriya. Shukriya, are you here? Shukriya
Yes,
Sadaka?
yes.
Okay. And Liz. Is Liz here?
I should.
Or is Liz someone? Or is Liz not a student? We could go to Soria. Soria. Are you here, Soria? So I've got Shukriya.
Yes.
Shukriya, you can be Jenny.
Yes.
Homera
Okay.
Jamali. Homera Jamali.
Miss, you're talking about which Shukriya?
I'm talking about, oh my goodness, I did not realize there were two. Okay, I should have written your surnames down.
So there's Shakriya Amini. I think she might have had a turn though.
Yeah, no, it's not Shokoria, it's Shukriya.
Oh, Shukriya, yeah.
Yeah, Shukriya, yeah. Shukriya
Yes,
Sadaka.
Yes, I'm here.
Shukriya Sadakat, right?
Yes.
Okay, so Shukriya Sadakat and Homera Jamali.
Okay. Talking
Humira,
about
you here?
Yes, Miss.
Okay, Humira,
Yeah.
you can be Fatima.
talking about hormones, have you noticed to change in Hugo and Ali? They have both showed up.
Oh yeah, puberty is starting. They are getting moody and Alice's voice is changing.
Hugo need to start using uh, the
Deodorant. It's a hard word. Deodorant.
deodorant.
Yep.
Deodorant poverty is an example where hormones don't keep the balance. Instead, they sugar and make big changes.
Good work. There are lots of hard words there too. So that word is surge, that one. So I just realized.
That's a very hard, that's quite a hard word, surge,
Yeah.
you know.
Yeah.
But it really just means that something gets bigger and more very quickly. Yep. So
like a wave, you know, sort of a big wave that might crash down, something like that. And I just realized we should have done this slide first before I got you guys to read it, because that would help as well if we practice the words from that dialogue. So hormones are the those things that float around in your blood and send messages from one part of your body to the other. And some of the hormones you might be familiar with are insulin, testosterone, estrogen, cortisol, and glucagon. Glucagon has the opposite effect to insulin. Like so that's what helps bring the glucose into balance. So if you've got too much glucose in your blood, insulin will be released. And if you don't have enough glucose in your blood, glucagon will be released. And then that brings the blood glucose back to balance. This is not a very good diagram for balance because there's not balanced. But anyway. So normal range just means that even when you have the normal range is not just one very small defined point. So every individual can have different ones, or you can have different amounts during the day, but there is a normal range in which, in this case, normal blood pressure is 90 to 119, for example. So if you get any blood pressure result between those two, then that's considered normal. So range refers to the fact that you have a lower limit and an upper limit. Regulate is the word where we use an action to change something into what we want it to be. In this case, the body is changing the levels of glucose. It's regulating the levels of glucose. So to try to back into a normal range. And then lifestyle. Lifestyle refers to how you live your life, usually with respect to things like your diet, what you eat, or how much exercise you might do, how much sleep you might get, how much stress you have in your life. Those sort of things refer to lifestyle. All right, so let's do a practicing with a matching exercise for some of these terms. So who's next, Nikki?
Rosina? Rosina, you here? Rosina?
Yes,
No?
ma'am, I'm here.
Oh, hello, Rosina. Yep. Do you want
So
to
we'll
do
do
the
one
matching?
person for each one. Yeah, if you just do the
And
first one, because
unhealthy livestyle.
lifestyle. Can you say lifestyle?
Lifestyle.
Lifestyle. Good.
And
So and
unhealthy
unhealthy
lifestyle.
Yep. So which picture do you think goes with that one?
Number 2.
Yes, good work. Number 2. Okay, some of these pictures are a little bit hard, so you might need to think about them a little bit. Okay, who's going to do the next one, Nikki?
Mariam Panahi? Mariam Panahi?
Yes, ma'am, I'm here. Normal
good.
range of blood glucose. I think it is number 1.
Yes. So, I mean, that's not a bad guess. So when we're talking about range, there's a low range and a high range. And so the thing that's giving it away, I think, is this one here. So it's number 5. But yeah, so the normal range is from 70 to 100. So actually, if you're getting 120, that might mean you've got too much glucose. So this picture is supposed to be of a blood capillary with lots of red blood cells in it. And then they've got little white sugar cubes here to represent the glucose. So for a normal one, they're saying that's roughly how much glucose you should have in your blood. Okay, next person.
Nargis Jamali. Nargis Jamali? Nargis? Okay. Dr. Afghan. Are you here today? Let me put your name down. Okay. Nasima. Nasima, are you here? Okay. Nazifa. Nazifa Hasari. Are you here today? All right. If you don't want to, that is not a problem. Somaya. Samaya?
I'm here.
Okay. Is that Samaya?
Yes.
Okay. Thank you, Samaya.
Okay. Our bodies regulate their temperature. I think it's number 3.
Good work. Yes. These are a little bit hard, these questions. So you guys are doing a good job. So regulate, that means that you try to make the temperature go back to the normal range. So this person's too hot, so they're sweating to try to get themselves cooler. This person is too cold, so they're clenching up warm to try to keep the heat inside to keep themselves warm. Good work.
Okay,
So
teacher.
next person.
Thank you.
Thank you.
And Tamana Hashimi. Tamana, are you here?
Yes, I am here now.
Thanks, Tamana.
Okay. My body will make a hormone to release glucose into the blood. It depends to number 4.
Yes, good work. Yes. So you had to understand what was going on in these pictures. So that's very good work that you figured that one out. So congratulations. Okay, next person.
Okay, the next person I have, so I'm just going to call these names one more time. And if you're not here, if you're here, just call out. Zakia. Nargis Jamali.
Yes, miss.
Okay, you can do the last one.
Okay. I need some insulin to tell my body to use up glucose out of my blood.
So this is a hard one, the way that I made the sentence up, but luckily there's only one more picture left. So you should be able to guess which picture that is.
Teacher, I think it's number 5.
Yes. Actually, if we hadn't already used number 5 for the normal range, I would have to say that you are right, because it's talking about getting your glucose back into the normal range.
Good work,
the
Nargis.
person
Well done, because I wouldn't have got that right, because this is very confusing, Nargis. But that's only because I don't know any science.
So the person who needs some insulin is the person who's got too high a reading for their blood glucose. So that's this person here, number 1. But in a way, you were right. So it's kind of open-ended, and I wouldn't be able to mark you wrong for saying that. Okay.
Good work.
Okay, so we started talking about puberty. So these are some words associated with puberty. So how many? Yep. Okay. So we talked about shot up, when the person shot up. So that's called a growth spurt, where you very quickly increase in size. Acne is the word for the pimples and that you get on especially on your face, but sometimes on other parts of your body. Acne is how you pronounce that word. Menstruation, or your period starts, is for women, for the girls, of course, and that's usually between 12 and 15 years old when you have bleeding. And then for boys, they will start getting more body hair, and they might have to start, in some cultures, they might have to start changing. And also they get a change in their voice. Their voice gets lower we call this thing here the Adam's apple in a man, where it gets a little bit bigger in the larynx and makes their voice lower. Then the other thing is the mood changes. So that was in the dialogue. The mood changes, is when you can be a little bit grumpy, and then you might be sad, and then you quickly change to happy. So that's what refers to. And then for women, you can get breast changes. Your breasts will start getting bigger during puberty. Sanitary products refer to things like the pads and tampons that we use during for menstruation to collect the blood that comes out. Actually, I should say the menstrual blood, because it's not just blood. Okay, we'll do another dialogue. This is between Mariam and Lisa. So, Nikki, would you like to be Mariam?
Yep. Did your mum give you the period chat?
Yes. Mum told me it's called a menstrual cycle because a bunch of hormones cycle through ups and downs. One of them goes crazy high and triggers an egg to pop out of one of your ovaries.
My mum told me it comes from the Latin word for month, because that's about how long the cycle normally lasts.
That's why they want us to keep track of when our period starts, to see when it settles into a regular cycle.
And track all the different things happening in our bodies so we get familiar with all of it.
Yep. Shame about the bleeding part.
Can I just ask people to switch your mics off? Mics off, please. Yeah. So if we could have your mics off. Oh, thank you. Okay. Okay. So we could have two people leading?
Nargis, Azizi, Shah, please turn off your mic.
Okay. Okay. Mahen, are you here today? Okay.
Yes,
so
I'm here.
Oh, Mahen, you're here. Good. You can be Mariam. And
Yes,
thank you. You can be Mariam. And Nasima, are you here? Okay, so we might go back and we will have Elaha Ashrafi. Are you here?
Yes, miss.
Elaha? Okay. All right. So you be Mariam, Mahen, and Elaha, you can be Lisa. Okay, go.
Did you ma'am give you the period chat?
Yes, mom told me it's called a menstrual cycle because a bunch of hormones cycle through ups and downs. One of them goes crazy high and triggers an egg to pop out of one of your ovaries?
Good work. Keep going. Oh, we keep going, Nikki, or do you want to get another two? I'll just
Sorry, I was muted. Yeah, please go on,
Yeah.
Mahen.
Oh,
Yeah.
yeah, actually, maybe before we go on, we're going to do more about this in next week's lesson. But ovaries are these organs here, these ones here. And what was the other one I was going to say?
And only women have them. Only women have ovaries. It's for women. Yeah.
Yeah.
So it's for all of us who are in this class, right? We have
Yes.
ovaries. Yeah.
Okay. Will we get another two to read this one then?
Okay then. So we can get oh, who can I get? Okay, I'll get Rahila. Are you here? Okay. Sarah Pashtunya. Are you here?
Yes, ma'am.
Yep. Okay, you can read for Mariam.
Okay.
Okay. And Latifa, are you here? Okay, Shukriya Amiri. Shukriya?
Yes,
Are you
miss.
here? Can I get you to read for Lisa, please?
Yes.
Okay, so let's go.
Okay. Mariam and Lisa. My mom told me it comes from the Latin word for months, Cassius that about how long the cycle normally lasts.
That's why they want us to keep track of when our period starts to see what is settles into a regular cycle.
And track all the different things happen in our body so we get familiar with all of it.
Yeah, but shame about the bleeding part.
Good work. Thank you. So we'll go back and do some more reading. That was good work. I'll just quickly talk about what we do to prepare for next week's class is to check the meaning of words and phrases to do with health conditions and puberty. So there's lots of new words we did today. So you'll probably need to practice pronouncing those words. And also we should compare the treatment of diabetes in your country with Australia. So maybe you can come back and tell us whether it's the same as what Fatima was going to have to do. And also, what do you call your period or menstruation in your country? What various words do you have for it? And then there's a multiple choice practice questions for you to do, and we'll check them before class starts next week. So there you just pick A, B, C as the correct answer.